Hi, I'm Dr. Troy Carter. I'm a comprehensive general ophthalmologist. I've been in practice for about 16 years now. I see 35 to 40 patients a day, and I have been using electronic medical records now for 1 year. This quick video is just to show you how I do electronic medical records. I also have an electronic practice management software system too. Both of them are web-based. I don't have a server in the office. I still carry my paper charts, and I'll show you how I do that. In the front office, I have 3 flat screen computers. They're HP PhotoSmart touchscreens. We don't usually use the touchscreen part. We usually use our mouse, but I've got them up here, and they integrate seamlessly the electronic practice management system and our electronic medical record, which is Integrity Digital Solutions. I would advise you to first contact your computer software management company in your town, get them to contact your electronic medical record, whichever one you choose, as well as your practice management record, because they can tell you exactly which cables to pull to integrate your whole system. Integrity talked with my group, and they pulled computer cables to connect my OCT, my visual field, my autorefractor, my lensometer. Everything's all connected. So we move patients back here. I have a contact lens lane. I bought 1 flat screen computer for that lane. I paid about $700 a piece for those computers. If you get software as a service like I have, there's a small initial outlay of finances, but it's software as a service, so you can call the companies and get upgrades. Usually they're provided for your monthly maintenance fee, and they can help you troubleshoot any problems you might have. We have a patient workup area where my techs put in their information, and they have their own flat screen to input data. We do have some scanners in the office, but typically I still carry a paper record right now, even a year out, and I plan on doing that for the next year, maybe even 2 years, as my past ocular history. You could scan everything in if you wanted to into your record, but I don't. I have 4 exam lanes, 1, 2, 3, 4. My technicians use 1 and 2, and they have their own flat screen computer in there, and they input the data, and then they have the patients wait for dilation, and then they bring them down to my room, which is my rooms 3 and 4. I put a flat screen out in the hallway that's connected, and I can look up here, and at a glance I can see exactly what's going on with each patient. With Integrity Digital Solutions, I'll have everything I need on 1 screen, and I can go in and I'll know what the patient has that I need to be looking at for that day. So I walk into the room. I have 2 flat screens. These are both 22-inch in my rooms. One of them is for my scribe, and one of them is for me. I sit in the chair, I have the patient sit down, and I do their exam. I usually have the chart off to the side, and then as I see the patient, I'm dictating what the findings are to my scribe. At the same time, while I'm talking to the patient, I can look over here and I can remember, because I can see their name, their birth date, their past ocular, past surgical, their history of present illness. It's all right there. So if I forget anything, I just look over and I can see it without doing anything. When I'm finished with the patient, I usually ask them if I can pivot to the side. I don't turn my back on them, and I'll pivot and I'll type in their assessment and plan, and then when we're finished, I'll talk to the patient again. And then I turn to my scribe, and we decide how we want to code the patient and document that. So, 1 year out, how is it? I really like it. I'm much more efficient with my documentation. I like my EMR, Integrity Digital Solutions. It was an easy transition for me. I've heard horror stories about some companies, but so far I like the way it's been working. And I hope that you have a good experience as you initiate your electronic medical record and transfer over from paper records. Thanks.